Namaste and welcome to the next lecture of Clinical Ayurved. Myself Dr. Mayuresh Agte. We have discussed in past few lectures about clinical application of a dravya and I have taken Guruji as a specimen in front of you. I have taken much more time on Guruji because just to set an example that how a drug should be clinically used in practice and it is not it will be not successful unless and until you know which exact guna about rasapanchak or factor about among the rasapanchak is needed and which factor is to be balanced when you are using that drug in a particular samprapta. I have purposely not mentioned anything about amay prayog, about Sayog of Guruji with other drugs in a particular disease because I want to set you example as a single drug of Guruji. Now it is your choice that how you will combine Guruji with other drugs in any disease which we have discussed. So I restricted myself up to Anupan and Kalpana of Guruji and Dravya Sanyog, Amay Prayog. Now you can evaluate according to the patient in front of you. Today we are going to take another example of dravya and its clinical application but in a different way. Guruji we discussed on the basis of shlok mentioned in the Bhavaprakash, but we can evaluate a dravya on the basis of gana also. And in that case, gana of described by Chara Samhita are very important because they are based on the karma or action of that drug. So let us start with the today's lecture and the dravya which I have taken for the lecture is Yashti Madhu. Now let's just see the gana of Yashti Madhu. It is used in described in variety of drugs like Kanthya, Jivaniya, Sandhaniya, Varnya, Kandugna, मूत्र विरजनीय शोणित स्थापन छर्दी निग्रहण स्नेहोपक वमनोपक आस्थापनोपक. So this dravya is mentioned in the variety of the gana and hence I have taken this as an example for clinical application. Now many a times in the mentioning the gana you will find that Madhura Skandha, Pitta Skandha, Kashaya Skandha, so you can evaluate the rasa and other from that particular word. But now in the case of Yashti Madhu, it is not mentioned as any rasa viravipat are specifically in the Gana category. So in that case we have to evaluate or we can evaluate when we start reading the Gana because in every drug you will find Gana as a first line. So we can start analyzing the dravya when you go through the gana mentioned in that drug. So let us start with the Yashti Madhu. The gana are Kanthya, Jivaniya, Sandhaniya. Now first we have to evaluate Rasapanchak and then we will discuss. Then we will be able to analyze the action which are given in the Chara Samhita. So Kanthya, Jivaniya, Sandhaniya. Jivaniya. As I told you in previous lecture about Rasayan Chikitsa and we have discussed difference between Jivaniya, Bruvaniya, Balya, Vayasthapan. I have mentioned that Jivaniya Gana is a nourishing Gana and the daily energy requirement are supplied by this Jivaniya Gana. The energy which is lost is recovered by Jivaniya Gana. And hence all these dravya are you will find are Madhur sheet. So if Yashti Madhu is mentioned and we don't have any Rasapanchak specifically mentioned in the Gana, on the basis of this Jivaniya word, we can say that this is Madhurasatma dravya as Madhurasa is a nourishing. Other dravya Snehopaga, it means it is Snigdha Guna, Daha Prashamana, it is of Shita Guna, Shodita Sthapan, it is again of Shita Guna. So we can on the basis of when we read the dravya, we can have in our mind that these gana indicate to the Rasavirupat, which are Madhura, Madhura Rasa, Madhura Vipar, because all other functions you will find that they all go on the same line of Samam Pratyarabdha Dravya and Guru Snigdha Guna. So Jivaniya, Sandhaniya, again Sandhaniya is roped, so it will healing the property, so it is Kaphavardhak. Jivaniya Gan, Sandhaniya Gan, Daha Prashaman, all these things go along with this Rasavirupat, Madhur Madhurashit, Guru Snigdha. So when you read the line Gana first in the description of any dravya which are in the books, start in your back of mind the Rasavirupat. If mentioned in the specific Gana, it's very nice. Not mentioned, evaluate on the basis of the karma. Okay, so now we will discuss these activities or karma of the Yashti Madhu on the basis of Madhur Madhurashit Guru Snigdha. Sometimes it can happen that Dravya is Vichitra Dravya and not mentioned in the Gana specifically. In that case, you can have to take the support of the shlok, no doubt about it. But just I am saying you that reading the Gana, we can analyze Rasavirupat Guna as we have done it in Yashti Madhu. So now we will build the building of the Yashti Madhu on the basis of Madhur Ras, Madhuripat, Shita Virya, Guru and Snigdha Guna. Now Gana is first is Kanthya Gana. Kanthya means Ya Pratyay, as we have told, we had discussed previously. Ya means good to, better to. So Kanthya means good to Kantha. You can say Swara Sotas, larynx, what you can say. Now, what it means, if it is Madhur Madhurashit Guru Snigdha Dravya, then it will be useful as a Kanthya when there is Vataja Swara Bhed. Okay? When you go to a trip, you shout. When you are seeing a cricket match, you shout. Or in the function, you shout. Or some ice cream like Shita Padartha Sevan is done, there is Swara Bhed. So all these, you generally will find Swara Bhed in the case of, mainly in clinical practice, it is towards the Vataja Swara Bhed most of the times. Okay, so Madhur Madhur Guru Snigdha, all these are Vata Shaman. Now what to do about the Shita Virya again? You have to balance the Shita Virya. Shita Virya is Vata Prakopa. So in that case, you can give with the Anupan Koshna Jala. What is the meaning? Jala is Madhur Ras, Madhur Vipas, and Koshna Jala will balance the Shita Virya of Yashti Madhu. Again, it is of Siddha Gunatma. So this Koshna Jala Anupan will help to reduce the Vata Prakop and Vataja Swara Bhed can be taken care of. Second one, you can chew the Yashti Madhu in the form of Yashti Madhu Ghanasar. So Ghana is again having the Ushna Samskar, it is also useful. Merely Yashti Madhu Churna is also useful to just put in mouth, say for more chikitsa throughout the day. Now, generally it is taken as Vataja Swara Bhed, contains Swara Bhed and Swara Bhed as a disease. But as it is a Jivaniya Dravya, it can give strength to the Kantha, to the people who have a profession like professor, like working in the call centers or any other profession where there is continuous talking, a commentary person or any other thing. They have got constant talking, so there is constant Dhatukshay, and that's why to recover this Dhatukshay, this Jivaniya Dravya like Yashti Madhu is very much useful. So not only when there is Swara Bhed or any disease of Kanthya, to restore the energy of the Kantha or Swara, you can use Yashti Madhu on the daily basis. And when to give it? Give during their work time. So when they are talking throughout the day, if you ask them to have Yashti Madhu in their mouth, this Yashti Madhu will that give strength to the working vocal cords or srotas, and that's why they will get a constant supply of the energy, the kantha as a organ, and hence dhatuksha will be remain in control and the energy lost will be recovered. We will take other gana in the next lecture. Hope you will like this way of analysis of dravya also. Thank you very much.